And now I'm really excited to introduce Dr. Ece Bayram. So she's new to our department and just recently joined us. And she earned her MD and PhD at Ankara University in Turkey. She completed research fellowships at the Lou Ruvo Center for Brain Health in Las Vegas and at the University of California, San Diego. She's committed to research, education, and outreach in the field of Parkinson's disease and other Parkinsonian disorders. Her research focuses on sex, gender, ethnicity, and race differences in Parkinsonian disorders, and she's funded by the NIH and the Lewy Body Association. And so she's going to talk to us about research updates, and we're very excited to hear about that. Thanks.
All right. Well, I'm very excited / anxious. Be nice to me. It's my first talk here. So I'm Ece. I'm from Turkey. I'm very excited to be here. Has anyone ever been to Turkey by any chance? Good. We have a pretty good amount of people who's been to Turkey. Well, it's a great country and great people come out of it, in case you haven't noticed. So I'm going to talk to you about research, subject dear and near my heart. But I want to give you a couple of facts first, because we've had some very exciting advances happening in Parkinson's lately, and it has made its way into the news. And it always freaks us out a little bit because we don't want you to get the wrong impression from those news. So we have some biomarkers coming out that are very exciting. We started using them at our clinic too. But just as a disclaimer, right now, we define Parkinson's disease based on the clinical symptoms. So you may be able to get biomarker testing yourself. They're becoming commercially available. But unless you have the symptoms, you have the problems, we're not able to diagnose you with Parkinson's. And we're going to use those biomarkers to help us with the diagnosis, not make the diagnosis on its own. We do have treatments for Parkinson's. You heard about them. They don't alter the course of the disease, but they can be very beneficial, especially early on in your disease stage. And we tailor it to each person based on your needs, your problems, what you want to get out of the medications you're receiving. And it's based on you. It's your call. How you want to go along with the treatment is all up to you. At the end of the day, the doctor can prescribe you anything, but if you don't want to follow it, you don't have to follow it. It's on you. So you're at the center of the treatment, and you are the decision maker when it comes to your treatments. We don't have a cure yet, but we have so many research studies happening. This year, we were excited that the president signed the National Plan to End Parkinson's Act, which is going to mean more and more research to actually funnel resources to hopefully cure this disease and make that cure available to all. We saw a lot of advances happening in Alzheimer's once they started investing more, and now we're going to see it in Parkinson's. We're pretty excited about that. And you can see that over the years, the research studies being published on Parkinson's increased a lot. Last year, we had over 10,000 research publications coming out on Parkinson's. This year, we're not even at the end of the year, and we have over 7,000 research studies coming out. It means a lot of people are really hustling to improve your well-being as you're going through Parkinson's. And you can see that there's a lot of research studies focused on treatments particularly as well. These use some new agents, some old agents, but we have over 140 treatments right now in the experimental phases that we're checking if they work on Parkinson's or not. So just like a general overview, we define studies that have human participants as clinical studies, if they have to do with diseases. And clinical studies, we can kind of group them under observational, where we're checking how things are. We're not necessarily interfering with anything. And interventional clinical trials, where we are interfering and we are poking you to see how things are changing with your disease. But in general, these studies have a protocol. They're usually funded by different agencies. It can be people, institutions, companies, and the funders are usually not too involved with how the data is getting collected. They monitor to make sure the data is getting collected properly, but they're not the ones that are coming out to you and collecting the data necessarily. Usually we have a principal investigator that leads each protocol at the sites that are being conducted. They are monitored, approved by an institutional review board, so they have to follow a code of ethics. You can't just go out there and do whatever experiment you want when it involves humans. And you can only be included in research as long as you consent to it. You're not included in research if you don't want to be a part of it. No one is going to force you to be a part of research. And you may change your mind once you start going through research too. Maybe conditions change, you're no longer interested. Maybe you didn't appreciate the opportunities you had so far in that research study. You can back off anytime. It's not a one and done deal. And maybe you had experience with research before. Maybe you loved it. Maybe you didn't like it. It doesn't necessarily have to be the same for every research study. Every research study is designed very differently. The requirements, the eligibility, the time commitment expected from you, and the settings differ across studies. So your experience may look different from one study to another. So clinical trials are not like, we have this drug, let's test it on people, get it approved, and get it out to the public. It doesn't work like that. First of all, we have to make sure it's safe to be used on humans. And we go through different phases to make sure that it is indeed safe and it does show some benefits to people. So we start off with very small pool of participants to test out if the drug, the intervention we're using is safe, if there may be some hopes for benefit, and then we move it on to a larger pool each phase. And once you're done with a large enough pool, you bring it to FDA, and they're the ultimate decision makers to say, all right, let's make it out to the public or not. And after the drug does get approved, we actually continue doing research because now you have even a larger pool of people with diverse backgrounds using that drug, and we get to see if that benefit is exactly as we had hoped for it to be, even after the FDA approval. And that is kind of why you may see some studies where we're actually using drugs that you've been using for a while maybe, and we still want to get to know more about the drug. That's what happened with COVID vaccines, for instance. We kept getting vaccinated, but they kept getting collecting data to make sure the vaccine was doing what they had wanted to do. And the thing you have to remember about research, it takes time and perseverance. It takes time for a drug to be made from scratch, make it all the way through the phases of the clinical trials, and come out to the public. And even once the FDA approves it and it's publicly available, it may be very costly until some time passes and more generic versions are coming out, bringing the price down. So sometimes you may be a part of a research study, but that drug, even if it helps you, it may take a long time for it to hit the commercially available platform. So we really go into it with a lot of hope, and we push you. We hope you become part of this because we know that it's going to take a lot of persistence from both ends to make a drug come out to the public. And why not participate in research? You know, you actually do get direct benefits, even though a lot of the observational studies we say you may not get direct benefits, but you do. And also everything that is available to you right now that you're using, including what we know about exercise that Dr. Wheeler mentioned, it is because people in the past were willing to participate in research, and they contributed to what we know about Parkinson's disease right now. And since it takes so long for a drug to hit the market, you can actually gain access to these new treatments if you're in that research study, because they're not going to cut you off once you're done with the study. We actually move it to open label, and you keep staying on that drug for a while until it becomes commercially available. So you actually get that private early screening for the drug benefits. And also, you know, we're kind of obsessive to make sure that you're fine during our research. We don't want to hurt anyone, and we want to make sure we're on top of everything. We're not missing anything about you during research. So we're going to give you a pretty extra level of care and attention that may get annoying at times, but we just want to be on top of things to make sure everything is going fine for you. So we have a bunch of studies at our center, and I'm going to talk to you a little bit about those. And a little fun fact, so Ece in Turkish means queen, and luckily I'm a big fan of queen, so that worked out. And I hope you're excited about the research studies we have here. We're going to start off with observational studies. So first off, I wanted to mention the PPMI, Parkinson's Progression Markers Initiative 2.0. It is funded by the Michael J. Fox Foundation. If you know about Michael J. Fox, he's done a lot for the Parkinson's community as someone living with Parkinson's himself. And he's funded this enormous initiative that helps guide a lot of studies for biomarkers, for clinical trials. And now we have the second version of this study. And we have 4 different groups that you can become a part of if you're interested. We are looking for people at the early stages of their disease, so diagnosed the last 2 years, not taking medications yet, or if you don't have Parkinson's disease, but you have a family member, a first-degree family member with Parkinson's disease, you can also get included, and also people with Parkinson's disease risk factors, some of the genetic risk factors Dr. Force mentioned, and also a couple of other markers we have before you get Parkinson's disease, you can get involved. And also we're looking for healthy controls too, because you got to compare everything to people that don't have Parkinson's to see what is effective in Parkinson's. Oop. All right, my slides wanted me to shush about that. So the second one is the LEARNS trial. And this one is a little bit fancier. You're going to get a wrist-worn device, a mobile application to use. It's not tricky to use, and they actually guide you a lot on how to use it. So even if you're not very tech savvy like me, you can still figure it out. You're going to do much better with these things than me anyways. And we want to see if these devices can help measure activities of daily living from home. Because if you come to the clinic, we get a very little snippet of your disease, right? You don't really get to share every single experience you have with Parkinson's disease at the clinic. But with these devices, we can assess how things are going for you at home, and we can get a better picture of what you're going through with your disease. So if you have a Parkinson's disease diagnosis, this may be an interesting one. We have a sleep research study to learn about abnormal sleep in Parkinson's disease. It's a very short, quick and dirty study too. And if you have diagnosis of Parkinson's disease and you act out your dreams, maybe your bed partner mentioned that, hey, you punched me last night. What the hell was that? You may have REM sleep behavior disorder, and you may be eligible for this one. We have an EEG, electroencephalogram one, and this is to see if we can get some biomarkers with EEG for people with freezing of gait and mild cognitive impairments. Because right now, freezing of gait, mild cognitive impairments, their diagnosis is based on our clinical exam, our detailed cognitive testing. But if we can get biomarkers, it may make your life easier so you don't have to sit through hours and hours of testing, and instead they can do a quicker test and tell you, okay, we see that you have this. We will indeed try to address this. So you have a diagnosis of Parkinson's and you've been stable with your medications for at least a month, and you still have a decent response to levodopa. This may be a good study for you. And we have the study that has to do with inflammation. So inflammation, we see it happening and acting out in a lot of neurodegenerative diseases. We know that it plays a big role in Alzheimer's, and we have clues that probably comes into play a lot with Parkinson's too, and we want to understand that more. So this is one-time visit. We just steal some of your blood, bombard you with some questionnaires, poke you around for a physical exam, and we see how inflammation is happening for you. And we also want to compare it to people who don't have Parkinson's, of course. So we're looking for controls for this one as well. So these were more biomarker-related ones. Now we're going to dive into more care-related ones. So PDG and Dr. Force mentioned, I'm not going to dive more into it, but I think something that is very exciting about the study is genetic counseling. I'm coming from Turkey and we did not have genetic counseling. We would basically just blurt out the genetic testing results to people we see at the clinic, which is a terrible way of disclosing information. And I feel like having a genetic counseling available to you for free is a big appeal in the study. The Drive PD study, so is anyone in this room good with Spanish? Does anyone speak Spanish by any chance? Great, all right. I'm gonna switch to Spanish for a little bit and please correct me if I totally mess it up. Por este proyecto buscamos la gente hispana latina con la enfermedad de Parkinson porque queremos saber más de su experiencia. Y solo es una entrevista. Si tienes interés en este proyecto, por favor, contáctanos. And if my Spanish sucks, you guys didn't know anyway, so I feel good. Was that okay? All right, good. I haven't spoken in a while, so. But, you know, a lot of the research we know right now come from non-Hispanic white people, which is great because we know a lot about Parkinson's, but we also need to know about the experiences of other communities too. A lot of the information I was reading, going through med school, my clinical training, I felt like these don't apply to the Turkish people that I see. And I think we're struggling with that even inside the US, where a lot of the information we know don't really apply to every community. So we want to find out more about the Hispanic Latino community to actually be more helpful to them at the clinic and during research. Now, a little bit more niche studies for deep brain stimulation. So there is a long process to getting deep brain stimulation. You actually go through a lot of evaluations. You have to make a decision, an informed decision, and it takes time. So we want to know if providing you with a decision aid is going to improve that process. And we also want to know if you have cognitive issues, is that interfering with your deep brain stimulation evaluation journey? So if you have been interested in deep brain stimulation and went through the evaluation process, we would love to get you in these studies. And something else is deep brain stimulation is unfortunately a bit more common for men to go through. Women don't get deep brain stimulation as much as men, and we want to know why. You know, I have a lot of opinions myself, but of course my opinions don't stand. We need to hear it from the people that actually go through the process, right? So we want to know if women have made those decisions to not go through with deep brain stimulation surgery for certain things, certain barriers that we can address. Now, the interventional ones, the clinical trials. So exercise is a big thing, but we still need to learn more and more and more about exercise. A lot of the times people say, okay, I know I'm getting told to exercise, but what exactly do I need to do? So that's why there is still so many more studies on exercise, and we're doing this one that has to do with seeing the impact of exercise on sleep and cognition in Parkinson's disease. If you can exercise, if you don't have any underlying conditions that stop you from exercising, this may be a good fit for you. Another exercise study. This is for early stage Parkinson's. So if you have not yet started your Parkinson's medications, if you were diagnosed within the last 3 years, we want to see how exercise is gonna impact your disease progression, maybe slow it down earlier in the process. Well, speaking of exercise, unfortunately, broken bones are a little bit more common for people with Parkinson's. And it's a big concern, and we want to prevent you from having any fractures. So this study looks into whether using an injection, 1 dose of zoledronic acid can help prevent those fractures. So this is a very quick and dirty study for you too. You just get 1 injection at home, and then you keep getting bothered to see if you had any more new fractures during the process afterwards. So the LUMA study, Dr. Forbes already mentioned. I'm not going to go too much into details, but this is an oral tablet. And the Activate study, Dr. Forbes mentioned that one again, so I'll leave you alone with that one too. And another deep brain stimulation one. This one is focused on freezing of gates. If you already have the Gevia DBS system, there's no more new surgeries, new interventions, new medications or anything. We just update the stimulation to see if that helps with freezing of gates. So if you have freezing of gates, if you already have this DBS system, this may be a good one for you. And I personally focus a lot on Lewy body dementia, so I really wanted to mention this bonus study. So this is not a University of Colorado study in particular, but this study is done over the phone. If you're caring for a loved one who has Parkinson's disease dementia or dementia with Lewy bodies, you can talk to other caregivers and get peer support from them through this phone-based study. And you can either go through the mentor training yourself to actually provide support to the others, or you can receive support from the others by being a mentee, and it's done completely remotely. You just get, if you decide to be a mentor, you can get training virtually, and then the interactions with the other caregivers in the program are over the phone only. And with that, I'm gonna let you go on to the break, but I just want to remind you all that research is done with you and it impacts all. So if you decide to take part in research, it's going to impact the whole Parkinson's community. People who have taken part in research before have provided benefits that we keep using to this day. If you're interested in participating, or if you previously participated in a study that we had conducted and you want to find out what the results were, because you should know. Or if you want to be involved with research beyond participation, you know, we are involving people living with these diseases or caring for their loved ones with these diseases to get involved with the process, starting with the study design, because you know what's best as you're going through research. You know what works, you know what doesn't work. I know we have a lot of opinions, but your voice matters a lot, and we got to shape studies from now on with your participation. So please contact us. This is the contact information. Dr. Forbes, Dr. Amara mentioned that too. And I'm going to end it with a lovely lyric from Pink Floyd. I don't know if you know about Pink Floyd. They're one of my favorite bands. They're very new. I feel like they're going to go to good places. And they have this song that I really like, and I think it really speaks to where we are with Parkinson's, where we are with research. There's a lot of hope. We're doing this because we have hope. A lot of those companies, a lot of government agencies, funding agencies are funneling money into this field because they have a lot of hope. No one would invest in something they know is going to fail. So we have a lot of hope. I think we're seeing the light at the end of the tunnel, and we're going to cure this disease one day. So I hope you consider getting involved with the process, and just remember, you're not alone in this path. It may feel lonely, but you're not alone. And especially when it comes to research, we do it as a team. No, together we stand, divided we fall. Thank you so much.